last year, we know that over 10,000 suspected cholera cases were recorded, over 350 deaths were reported. This is across 30 states, so this is like almost the entire country. Nigeria is the second worst country that practices open defecation.
There was a video that was going around a couple of weeks ago of someone pooping on the bridge. What? Pooping on the bridge in Lagos.
Yeah,
Yes.
and someone caught him and demanded that he fixes it.
Exactly. Exactly.
I always get excited when I see the federal government of Nigeria become strategic about, tackling so many of the pressing health issues we have. And today, we will be discussing one of these. But before we dive into our topic for today, we want to, first of all, welcome you to another episode of Break It Down podcast. I remain Chibuike, and of course, with me is
your co-host of the Break It Down podcast, Asari. Now, if this is the first time you're hearing our voices, this is the Break It Down podcast brought to you by Nigeria Health Watch, where we dive into compelling conversations on health issues and, other issues shaping our world. Thanks for clicking on our little podcast.
It's not little though.
Fair enough. I mean, it's our baby, right?
Right.
But like Chibuike said,
that is growing.
It is growing. Mm-hmm. It is. It's been 2 years. Anyway, like I was saying, as Chibuike said earlier, today we are discussing a very pressing health concern, cholera. So there was a period last year when we were getting warnings from the Nigeria Center for Disease Control and Prevention, NCDC, of a cholera outbreak in some parts of Lagos. And it got me thinking, why are we still battling with disease outbreaks like cholera today?
Yeah, true. I was really surprised, and when I found out in 2024, I think the notifications we were talking about, Nigeria actually observed a sharp increase in cholera-related deaths, over 10,000 reported cases and 359 deaths. And, sometimes we call these numbers just numbers, but these are people, like you and me. So it's always good that we keep that in mind and take why these conversations matter. And yes, that number is quite high compared to the previous years, which was, 3,689 cases and 128 deaths, unfortunately.
Yes. Okay, before we go too far, what is cholera and how do you even know when you have it?
Well, we have public health experts, but yes. Nigeria Health Watch, health communication and advocacy. So at least the basics of it, we should be able to let our audiences know and break it down, because that's why
we're here.
Try to do. So cholera essentially is an acute in the sense that it happens fast.
Comes on all of a sudden.
And it's a diarrheal infection, so all of the stooling and loss of liquid, fluid and all of that. And usually people get it from eating contaminated food or contaminated water. So food handling, very important when it comes to cholera. And it's been a significant health threat for Nigeria as far back as the 1970s.
The 1970s?
It's a long time.
I think that's very alarming, especially seeing as we had a spike in the number of cases and deaths last year. It shows how urgently we need to start applying effective interventions. So we all know that factors like, widespread poverty, lack of basic infrastructure, inadequate water, sanitation and hygiene services, these all contribute significantly to these outbreaks. But what are we doing as a country to actively fight it, especially if we've been having cases since the 1970s? 2025.
That's a long time, though. But yeah, I would say you're asking what we're doing to fight it. I would say what I'm doing. And I think it's something that has now become a part of me since COVID. Hand washing. Like
Same.
It's a normal thing with me now. Before, I don't think I was that conscious. Whenever I come, sometimes even when I come to work, like, all the touches, driving and whatever, I wash my hands before I get into it, because I know I'm going to shake people. So it's something that's become a part of me, and it's one way. So I'll say what I'm doing. But for Nigeria, Nigerian government has really recognized these challenges, and in response developed the National Strategic Plan of Action on Cholera Control. For short, is NSPACC.
Can we call it unpack?
Well, I don't know. So it was launched in February 2025, and I remember reading about it just briefly, and I was really excited because it proposes a national roadmap that focuses on prevention rather than outbreak response. So instead of waiting for it to happen, preventing it from happening, which is really good.
I see. Sometimes things seem so bleak, really, but it's very encouraging to see such a comprehensive approach, or read about such a comprehensive approach.
Yeah.
But thinking about it, what does this plan actually mean in practical terms?
Right.
How are these strategies being implemented?
What does it have to do with you and me
yes.
every other Nigerian listening to this podcast right now? Very important. But of course, you know how we do it here. We don't, know everything. We don't claim to know everything. So we bring in colleagues, experts who are part of these conversations to help us break it down. And to shed more light on this, we've invited our colleague Emeka.
Why is he smiling like this? I'm so confused.
You ask him that off record. Maybe something happened. But he's our in-house expert for today. And for those who are regulars on this on our podcast, I'm sure you've heard his voice before. He's hosted a special climate series podcasts that we launched last year as part of our Future of Earth conference. But we featured almost all the episodes on the Curated Conversation podcast. He's been part of this strategic action plan for cholera control, part of discussions, and SPAC, like Asari calls it. It's Asari that gave it that name, not me, just for the records. But we have him today to join us and to help us, make sense of all of this and what it means for us. Welcome to the podcast.
Thank you so much, Chibuike and Asari. I was smiling actually because it's my first time, of course, being on the other side of
the hot seat.
You're usually the host. Welcome to being the guest.
Yeah, thank you so much. And as much as you guys are my colleagues, I still feel a bit tense.
Oh, are you shy?
No problem. So long as you break it down properly, because that's a ground rule. No jargons, no technical. We want people to understand these issues, because at the end of the day, we want them to join us in asking for better health care, right? For all Nigerians, for all of us, really. So thank you so much, Emeka, for joining us. We see that the Nigerian government has, we said earlier, developed the National Strategic Plan of Action on Cholera Control, and this is really in response to the constant outbreak of cholera. Could you give us an overview of this strategic plan? What is its main objectives and goals? What is it really trying to achieve for us as a country?
Oh yeah, thank you again, Chibuike. The first thing is to know about it is that about the plan is that for far too long, cholera response has been siloed mostly within the health sector, and we must also remember that the impact of the health sector in responding or preventing cholera is very minimal, right? We often see it as a health problem, right? In fact, we've seen in so many scenarios where when there's a cholera outbreak, increase in cases or deaths, unfortunately. There's so many. We always focus on the health leaders, the head of the NCDC, right? Asking why this is happening or what is being done. But we remember, we forget that cholera is a disease that we shouldn't even be having at all, and that is easily preventable, right? By providing the necessary infrastructure, things like access to safe water and sanitation and hygiene facilities. Just like Chibuike mentioned, on his own part, he's able to, he has adopted a practice of washing his hands frequently, right? Yeah. That alone has been proven to reduce the risk of any infectious disease at all, not just even cholera, right? Yeah, but this is just at an individual level. But when you talk about, at a systematic level, what other arms of government or government institutions beyond even health can do. Like when you think about the core of preventing cholera is in providing access to potable drinking water. It's not what the head of the NCDC would do or the Minister of Health would do.
Absolutely. There's
Anybody
actually
in
an
the health
agency
sector
for
would do.
that.
Yeah.
Exactly. Federal Ministry of Water Resources.
Exactly.
Exactly. When you think about ensuring that or preventing open defecation,
Yes.
right?
Yeah.
Ensuring that sanitation facilities, people are able to, they have access to possibly public toilets, even if you don't have toilets in your home, but at least public toilets, right?
Yeah.
It's not what the Minister of Health would do. So, but the question now is, why is it that whenever we have a cholera outbreak or whenever there's common cholera cases, people go to the NCDC? The reason, or part of the reason, is that the NCDC is the most vocal in talking about cholera issues.
Yes, and
so
we get all our updates from them.
Exactly. So people think because NCDC provides these updates, talks about the outbreak when it happens, that they are the go-to, or that they are the solution providers generally. Meanwhile, what they do is mainly reactive. When the issue has come, when cholera has happened, they are now reactive.
Is disease control.
Exactly.
So fair enough.
Exactly. There are some diseases that can be prevented by maybe the NCDC, or that NCDC can lead the prevention. But for cholera, right, it's a multi-sectoral approach. It requires actions from everybody, the whole of society, every society, from the individual level to the government level, what the government to do, and to what people like us in the civil society space are doing to do what we are doing, making this centering this conversation and making it topical, right?
Interesting.
Sorry, can I just ask a question?
Yeah.
So the National Strategic Plan of Action, right,
Yeah.
for cholera control, who is the originator of that document?
Yeah, so I was just getting to that because I had mentioned that there's been so much focus on the health sector, that's the Ministry of Health and the Nigeria Center for Disease Control. But what that plan is seeking to achieve is to bring everybody onto the same page.
Environment,
Ministry of Environment,
Agriculture.
No, Ministry of Environment, Water Resources,
Okay,
and the
great.
Ministry of Health.
Okay.
Yeah, I think they're the three core ministries driving this. Then, of course, other agencies like NCDC is under the Ministry of Health. So their respective agencies also come to play. But these are the three core ministries driving the response to cholera, because they are the ones involved. Yeah.
Okay.
So exactly. So that's really what it seeks to achieve, to bring them all together under the same roof, to respond and prevent cholera and control cholera using one unified approach and framework. And it's also aligned with the global roadmap to tackle cholera by 2030.
Interesting.
So this national, the INSPAC is like Asari mentioned. Exactly.
Okay, not we.
This strategic roadmap is aligned with the global roadmap to also reduce the number of cholera deaths by 2030. The target is to reduce the deaths by 90%.
I see.
Yeah, and also now further seek elimination of cholera in at least 20 countries, including Nigeria. Yeah, by 2030.
By 2030 as well. Yeah. Absolutely. So what I hear you say is the plan essentially brings all of these people together. So it's they see it as a all of society approach, sort of, not just Ministry of Health. But I have a question, and also essentially I also hear at the end of the day, it's going to benefit all of us as Nigerians.
Yes.
Okay. But just to clarify, is there a mention of the Ministry of Information and Culture, I think, and one of the agencies, especially, which should be the National Orientation Agency. Do they have a role to play there, or
they definitely have a role to play. Asari had asked who the custodian or the owners of the document is. So those are the three ministries I had mentioned who are the core custodians. The Ministry of Environment, Water Resources and Health. They are the lead, right? But other ministries like the Ministry of Information and its agency, National Orientation Agency, NOA, they will play a very critical role in raising awareness, driving awareness and engagement to, unpack what this plan means, or even what the role of the public should be in doing this. Yeah. It's important that you even ask this, actually, because I remember during the COVID-19 response, that was really one of the first times I saw the National Orientation Agency being very active, mobilizing communities to take the necessary precautions to prevent COVID, through their various awareness drives, even down to local communities with their with their vans. I don't know what they call those vans where they have megaphones on top. Things like that. Exactly. So we need, in fact, I often think that if we could, the same attention we give to diseases like or outbreaks situations like COVID at the peak, if we can give that to diseases like cholera even before the rainy season comes, even before we start to hear high number of cases, right, we would gain more mileage before the outbreak comes. There's this saying that resonates with me from COVID, that you don't prepare for war when the war has come.
Yes.
So, and that's often what we do with cholera. We wait till the rainy season comes, and this thing happens every single time. When the rainy season
now.
Exactly, it's seasonal. So why do we wait for the rainy season to come and the cases to start to climb for us to start to panic? And we start to panic as if it's something that is surprising or that took us unawares. And
I really hope the agencies you mentioned that they are leading. You said they are the lead. I hope that they lead. In caps.
I'm also looking forward to that as well, because it's very common. It's now very common for us in Nigeria to launch very ambitious, well-written documents and plans and policies, but implementation is always the challenge. So what this document was, or this plan was launched in 4th of February. Actually, it was a privilege to have been there, and things would like to see really is, post the plan, right? To unpack that plan. What are the different roles and responsibilities of these ministries and agencies that you're talking about, right? How are they even, just last month, this Nigeria Hydrological Agency, they released a forecast, annual flood forecasts. I didn't even know there was something like that. I used to think that was just NIMET, releasing
me too.
Data of exactly. But it just shows us that there are multiple organizations doing multiple things that have potential and the resources and capacity to contribute towards addressing a disease like this. So if you have an annual flood forecast, and we know that flood increases the risk of cholera, because when there's how the organism that transmits cholera is mostly contained in feces, and when we have floods, all those toilets and
they mix with the water.
Yes, pit latrine. They are mixed with water, and people
have more contact with
exactly. People in rural areas that depend on surface water, now face the risk of drinking or cooking with contaminated water and things like that. So when you have a valuable data like the hotspots areas that are most prone to floods, right? I think that gives us an opportunity to act proactively, to now focus attention on those areas, to start to initiate preparedness measures for cholera, right?
Okay, so bringing it back to NSPAC, the targets or the goal is to reduce the cases by 90%, right? And I think that's ambitious and it's great, but we clearly need a step-by-step strategic plan, right? So, what are the strategies that are being employed to achieve this?
Okay, so from my understanding, the plan actually galvanizes multi-sectoral efforts under about nine thematic areas. And this is from, leadership. There's the aspect that has to do with leadership and coordination, surveillance and epidemiology. Of course, leadership and coordination is to really, who are the decision makers, this core ministries I had mentioned, that provide some form of leadership, strategic plan. Now, they've part of their responsibility is to articulate such a plan on what needs to be done, who needs to be brought on board, mobilize resources, We know that oftentimes the government, the 100% of the funding might not come from government. Who are the partners, that can commit resources to help address this issue? Now you talk about surveillance and epidemiology. Now we know that sometimes, to be realistic.
Sorry for cutting you, but what is surveillance and epidemiology?
Aha.
Honestly, I saw the way your head whipped around when he said epidemiology.
Right here, we break things down.
Yeah. Okay, so I'll say disease surveillance. In fact, it should actually be a common language for us, whereby, so disease surveillance is really ability to monitor and, to monitor the occurrence of disease.
Monitoring spirit.
Yes, exactly. To monitor the occurrence of disease anywhere in the country.
Yeah.
So the custodians or the leads for that are the NCDC. They have the frameworks and systems to, to monitor possible occurrence of disease. Now, so that's surveillance and epidemiology. Now, laboratory, right? This is like the third pillar. We want to be able to, when somebody reports, having diarrhea or watery stool, those symptoms of cholera, you want to be able to confirm and know for sure. And that's why the laboratory component is important. Then there's the aspect of case management, right? Where, when people now report this, are they able to receive prompt treatment and care? Especially those that have not taken this vaccine to prevent cholera, the OCV, or oral cholera vaccine. Then you have the fifth one, which is the oral cholera vaccine I mentioned is a preventive measure. The sixth is water sanitation and hygiene. That everybody can do. There's almost no excuses here. We know it's very difficult. It will surprise you that even in schools and some facilities that should ordinarily just provide water for people, right? You don't have the water there. Imagine a child in a school goes to the toilet and they struggle with water to wash their hands. So it already increases the risk of cholera. Then you have communication and community engagement is the seventh pillar. It's important that you take the sensitization to the grassroots where the highest burden exists of cholera and the people that are most vulnerable. Of course, there's the logistics pillar, manages the whole supply chain aspect of providing the commodities needed to prevent cholera. Then the last bit, which is the ninth pillar, research, right? I had mentioned earlier that there's annual flood forecasts, right? That's an aspect of research as well. It's not just nowadays we have AI. Technology has made it easy to get data, right, on where the hotspots of cholera is, where flooding happens the most, where even things like open defecation, you can even create an AI model, for instance, that maps out which areas have the highest rates of open defecation, and you can now get government or health authorities to now channel their interventions there and help address it, so that you don't go running around the entire country wasting resources and things like that. So in summary is that if they get it right with these 9 pillars, right, the document or the plan that has been developed will have a high chance of success. So this is really their approach. But of course, like I said, it's moving from plan to action and results is a different ball game. So I really hope this translates to improved water sanitation and hygiene facilities that can not just only prevent cholera, but literally every infectious disease from Lassa fever to meningitis, and really that there's increased ownership. I want a situation where if somebody sees Nigeria has the second worst is the second worst country that practices open defecation. So
there was a video that was going around a couple of weeks ago of someone pooping on the bridge in Lagos.
And someone caught him and demanded that he fixes it.
Exactly. So that is, if it's funny, but that is a form of accountability. Right? So we want a situation where we have, after India, Nigeria is the worst open defecation. So we want a situation where when people see things like that, understanding the gravity of the problem, are able to hold everyone accountable to do the right thing. I mean, there are some countries where if they are walking their dogs and the dog poops on the floor, you must pick it.
You pick it up, you bag it.
Exactly, you must bag it. So let's bag our shit.
Wrong. I love it. Thank you very much, Emeka. I think that this has been such an insightful conversation. Your insights into the NSPAC strategies and its potential impact, I think, is very enlightening. I think all of us need to know it and all of us need to learn. I'm also hoping that at some point, do you remember in primary school we used to do something called moral instruction?
Mm-hmm.
I'm hoping that at some point things like open defecation and tackling cholera, they can be woven into our national psyche from the second we enter like formal education.
Absolutely.
Yeah.
It's been so great to learn all of this as we approach rainy season, because that's typically when cholera cases start to spike across the country.
Yeah, absolutely, Asari. And I really like, Emeka, your emphasis on community engagement, because, what you said about accountability. I know some of these things, they may seem far-fetched, but those are the realities we see every day. Remember the story of someone drinking tiger nuts that was prepared with contaminated water. And unfortunately, the young man ended up losing his life.
Last year.
Really sad, but that shows that all of these things, it's not just about data and numbers, it's about our everyday reality. So it's important that we take responsibility and join in demanding for better healthcare and do our own bits, but also hold each other accountable. As we also continue to see strategies or push for strategies that will help Nigeria become cholera free.
All right, so before we forget, Nigeria Health Watch is going to be at the World Health Expo in Lagos on the 3rd of June.
Yes.
Yeah, that's really an important event. And Emeka, you'll be at the event. What should we be expecting?
Oh, yes, I'll be there. WHX Lagos, it's already convinced the private sector, a lot of private sector practitioners, medical equipment manufacturers, healthcare executives would be there. So it's a good opportunity for us to have a side event with them to discuss on AMR, antimicrobial resistance. So that's a fantastic opportunity for us, especially as next year Nigeria will be hosting a big event for the first time ever, the Interministerial Conference on antimicrobial resistance. So this is a good opportunity for us to start to build momentum towards that important conversation.
Love it. Thank you so much, Emeka.
We would love to hear your thoughts. What do you think, or what did you think of today's episode? Do you have questions, comments, or contributions around our efforts to address cholera in Nigeria? Do you have personal experiences and stories? Please to share them with us.
Yes, please reach out to us by emailing podcasts@nigeriahealthwatch.com, and don't forget to follow us on social media for all updates.
Yeah, that's it. Thank you for joining us on this episode of the Break It Down podcast, brought to you by Nigeria Health Watch. Until next time, stay informed and take action to protect your health and that of your community.
Sleepy.